It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Welcome to the Sam Lesante Show, folks. So you're carrying a little weight around, maybe a lot of weight around, and you want to know what to do with it. On today's show, folks, I have Dr. Martin Walko. Who is he? He is a general surgeon and a bariatric surgeon, and we're going to talk about how you who have weight that you've been trying to get rid of, how you can get rid of it. So, Doctor, thanks for coming on the Sam Lesante Show.
Thank you for having me.
And welcome to the area.
Thank you.
So, when did you come to our area?
When I was a child, actually, I used to visit relatives in the Swoyersville area. My wife has family in the Jim Thorpe area. When I was in training outside of Philadelphia, we used to come to the area to kayak and canoe. So it's more of a welcome back than it is a new welcome.
So now, where were you before you came here?
I was in northern New England, predominantly working as a rural surgeon doing endoscopy in open operations. Immediately before coming here, I performed a fellowship in advanced bariatric surgery and minimally invasive surgery. So that augmented the skills that I had from 16 years of working in New England.
Your career. Let's talk about your career because I found it interesting. From college, then you did not go in to become a doctor, right? You were in biology.
No, in college I actually did very well in biology and chemistry and microbiology, and several instructors encouraged me to go on to medical school at that point. I had other plans and was practicing, working towards becoming an ecologist and a biologist, and actually worked for a food company as a food microbiologist for several years. Actually, it was a candy company. And then while I was there, decided that I wanted to pursue a degree in medicine. So rather than finishing a master's degree in microbiology, I went to medical school.
When did the change occur? From biologist to going into becoming a surgeon?
Well, during medical school, when I was in medical school, I saw that surgeons had a unique opportunity to work with patients and correct problems and make them better. And it was that direct interaction and the ability to help people using my knowledge in science and my hands that made me want to be a surgeon. Did
you have anyone in your family in the medical profession?
No.
So it was just that you went?
No, I came from a family of coal miners that both parents went to high school, and they wanted us to get some other type of education and try to help people.
When you were working with the candy company, what did you do with the candy company?
I was what's called a food microbiologist, and that means we check the raw ingredients to make sure that there are no pathogens, no germs that can hurt people, and that the products are safe to eat.
So I find that interesting from what you were doing now into general surgery.
It's sort of similar if you look at the role as preventing people from getting sick, but not usually considering chocolate as a healthy thing, although now they say that the flavonoids are supposed to be good for our heart. But anyway.
Did you enjoy it?
Working at M&M's?
Yeah.
Sure. Working in the candy company? Yeah. Very much so. It was a nice bunch of people. It was a good experience. I certainly wouldn't change it, but it wasn't the sort of thing I saw myself doing for the rest of my life.
Now here's a very important question. What color do you like, the red, the yellow,
I'm told that the green ones are the best, and we used to jokingly talk about me being the proofreader that I got to eat the ones that were W's and E's. That was a joke.
Well, so what was your decision? I mean, from leaving the northeast part of the country, coming here to Lehigh Valley Hospital?
Well, I was working as a rural surgeon. There were very unique opportunities to help people who were either injured or who had cancer, or we could help prevent them from getting cancer. But I still wanted to be doing more to help patients, especially since obesity has become a major problem in the world and in our country. I tried to get training on a limited basis, but to really get the good training, you have to go back to school in essence. And that was, I was 50 when I started applying for fellowships in minimally invasive surgery and bariatrics. And it was just shortly after, a couple days after my 50th birthday, that I found that I had the opportunity at Anne Arundel Medical Center with Dr. Gansas, and it was a great experience.
Going into the bariatric surgery, okay, and we talk about obesity, which is correct, okay. You're also a general surgeon,
Yes,
right?
sir.
Okay. Do you specialize in bariatrics?
Yes, but while I do offer bariatric operations to the patient, I can also fix their hernias, take out gallbladders or an appendix or any other general surgery procedure. So by getting advanced training in minimally invasive surgery and bariatrics in particular, I'm able to offer more services to patients who need them.
Okay. Let's talk about the surgery, and then we'll go back to who the candidate would be for the surgery, okay?
Okay.
Now, bariatric surgery has been around for a while, is that
Yes.
correct? Okay. How many years would you say?
Well, when I was a resident back in the 90s, it was in its infancy, and at that point it was done open and had so many, frankly, complications that it was only done in specialized centers. As time has gone by, we've transitioned to laparoscopic surgery, which is less risky to patients. Our techniques have improved, and now it's a everyday operation.
So that's what I was thinking about, how the technology has changed.
Yes,
throughout.
very much so. As our digital technology and optics have changed, we're able to see and do more. The equipment has improved, operative techniques have improved, and we're also using scientific studies to find out what is best and which has the best outcomes for patients.
And I'm assuming, I'm not assuming, I know that Lehigh Valley has the latest in technology.
Absolutely, yes.
Or you wouldn't be here. When we talk about weight, we all, including moi, we all gain a couple pounds, okay? So when we and unfortunately the foods that are out there, you know that they're not healthy for you. So let's take a person who is on a diet, okay? Where do you consider obesity versus overweight? I mean, like, where is the difference here?
We look at an indication known as the body mass index, or BMI, which is a measurement that compares the relationship of a person's height to their weight. It's not a perfect test because somebody who's an Arnold Schwarzenegger bodybuilder will have an elevated BMI, but obviously they're not overweight or obese. But when a person is above a BMI of 30, they're considered overweight. Up to 35 is considered overweight. Over 35 is considered obese. And when you start adding what are called comorbidities, or health-related issues like high blood pressure or sleep apnea that are directly related to weight, those factor into making decisions about surgery.
All right, so a person who becomes overweight, all right, and when you, I mean, a person knows when they're going to be obese. I mean, they could tell. Right. Or how can you tell? I mean, if you're fat, I mean,
Well, there's a difference, a subtle difference, if you will, between overweight and obese, and the best thing is to have a conversation with your doctor about it. If you're noticing as you're getting, your pants are getting tighter, your clothing sizes are going up, certainly that's an indicator, but really the best metric is to have a true heart-to-heart conversation with your primary care provider and look at your BMI and see where you fit in the categories.
What I would recommend anybody who's watching the show, to get information, 501-4LVH, as you know, 570-501-4LVH, folks, just to call and get information. So as you begin to, there are many people who try a diet first, okay? And there are different kinds of diets, and then there's exercise programs. Around seasonal holidays or whatever, whether it's Valentine's Day, Easter, or summertime, wintertime, people have a tendency of maybe overeating or but overeating is one thing, but continuing on and you're beginning to put this weight on, okay? It's to determine, like, so would you recommend a person who is, overweight, trying a diet, or exercising or whatever before they come for surgery?
As we've studied wellness and what makes a healthy person, we know that a healthy diet and activity, exercise, makes people healthy. If a person is looking to maintain an ideal body weight, certainly cutting out empty calories, things along the line like candy and junk food, that's one of the first steps. And then a proper exercise program is also very important at regular intervals through the week. It's not the sort of thing where you can exercise once a month and try to save it up. It's really a balance of calories in, calories out, and then the type of calories are, I think, important because it's very easy to overeat calorie-dense foods that are high in fat and high in sugar.
Okay, now, this is what drives me crazy, okay? When someone says eat healthy, you know, so then what does eat healthy mean? Because then you hear, you gotta have fat. You gotta have some fat, you have to have that. Then you have to have protein, then you have to have your carbohydrate. Then you have fruit, then you have to have, I mean, so it drives me crazy, okay? So
I understand that can be very confusing. One of the pieces of advice that I give patients is to eat as unprocessed as possible. If you're eating a lean source of protein or a vegetarian source of protein, a lot of fresh vegetables and fruits, it's kind of hard to overeat. It's not impossible. But then again, going back to your primary care provider and meeting with an expert in nutrition is sometimes helpful. The internet has been a mixed blessing. I mean, I've honestly encountered people who correctly diagnose themselves with appendicitis by using WebMD.
I hate that.
And I've also encountered people who had cancer that talked themselves into some other diagnosis that was self-reached. The point is more that if a person is struggling with their weight or nutrition, asking an expert is more appropriate. You wouldn't go online and try to figure out what's wrong with your car and then go out and try to monkey with the engine yourself.
Good point.
So you would reach out to an expert if you're having issues with respect to weight or nutrition.
Well, I think that's, you know, I'm guilty of that because if I get something and I go, oh my God, I have this, I have that, because I'm the biggest baby walking the face of the earth. When you're looking at a person who is struggling with their weight, okay, there's many factors sometimes why people gain weight, okay? I find stress is always a factor in a person's life. They don't mean it, you know, they're great people, you know, just that, you know, things in their life have gone maybe haywire or whatever, and their stress, maybe with spouses, children, relationships, or whatever, work, and they begin to gain weight, and, you know, it's to the point, I don't care, I just, you know. I know you're not a psychologist, but for those people who come in for bariatric surgery, there's a routine. And when we come after break, I want to go through the process here as to what happens when a person says, I've tried the diets, I've tried the exercise, I've tried this, you know, it's unhealthy for me, okay, and the age factor. Folks, I'm talking to Dr. Martin Walko. Very interesting, folks. We all fall into that category. Where we, you know, gain a couple pounds and then then you gain a couple more pounds and then you're in trouble. You try a diet, you yo-yo diets, as you all know. Some of them work, some of them don't. This guy will help you out. When we come back, we'll talk a little bit more about that. Stay with us. Welcome back to the Sam Lesante Show. Remember, folks, 24/7, all of our programming on ssptv.com. My email, sam@ssptv.com. And for any information on our health shows we do at Lehigh Valley Hospital, Hazleton, go to LVHN.org. My guest today is Dr. Martin Walko. He is a general and bariatric surgeon. We're talking about if you're having a concern of health. So people, you know, they try their diets. And like I said, there's reasons why people gain weight. All right, so putting that aside, sometimes you have to address those issues,
Absolutely.
okay, so they don't continue on. But a person is in a situation where they are overweight, okay? And you mentioned again, now tell me the difference between overweight, because I have about an extra 10 pounds. You said you'll take off this afternoon for me, okay, no problem. But all right, so I'm a little overweight, but however, how do I know if I'm obese?
Again, the calculation known as the body mass index, or BMI.
And you do that test?
We do that test. It is available online. There are BMI calculators. It's a ratio of your height to your body weight.
Wow.
Normal tends to be between 18.5 to 25. Once you get over 25 to 30, that fits into the overweight category. And then over 30 is considered obese.
Okay. Now, there are some weight measurements that you know, just scales that have a weight body thing that they could tell when you're on, you know, with your bare feet. Is you ever hear?
I think you're referring to the scales that measure your percent body fat.
Yeah,
based
body.
on
Yeah,
impedance
yeah.
studies.
That has nothing to do with the.
No, that's not BMI, although that is helpful if somebody is a bodybuilder or a linebacker and they have a lot of muscle mass and you're not sure. But another good indicator of whether or not your weight is causing health issues is other health problems that you might have. For instance, high blood pressure is oftentimes related to being overweight or obese, sleep apnea, type 2 diabetes, cholesterol problems, lipid problems, and things like that.
All right, so now I know I have a problem. If everyone's like me, they're the biggest I'm a big baby. I call the doctor. I'm a nervous wreck. My blood pressure goes up to the roof before I even get in the office. So everyone's nervous and scared. So how do you make me feel at ease, Dr. Walko, knowing that I'm obese and I have to do something about this? How do you make me feel that this is going to be okay, Sammy?
Well, we just strike up a rapport, a conversation, sort of like we're doing right now. It's part of the art of medicine and surgery that we meet and interact with patients to help allay their fears and establish a rapport. That's very important. Trust is very important, and usually just normal conversation back and forth about things, and most importantly for a doctor or a healthcare provider to be listening usually helps to establish a relationship.
How do I know then there are different types of bariatric surgery? Okay. Now, do you explain that to me? Otherwise,
Absolutely.
Okay. So once you, so what are some of those types of different bariatric surgery?
In general, bariatric operations are either what we call restrictive, meaning they limit the amount of calories that you can take in, or they cause your body to waste calories or cause malabsorption, or it's a combination of the two. The gastric bands or lap bands that were available and still are available is a restrictive procedure where a plastic tube is placed around the top of the stomach, and it literally chokes the top of the stomach to allow very little food in. That causes some problems with heartburn, reflux, and scar tissue. And frankly, when you put in a foreign body and follow that person over 10 years, they're going to have a complication from that. That's one of the reasons that operation has fallen out of favor. The two other more common operations that are done these days are a laparoscopic sleeve gastrectomy, where we actually use a stapler to cut the stomach into about the size of a banana. That restricts the amount of calories that a person can take. And then the other operation, known as a Roux-en-Y gastric bypass, is where we staple the stomach so that it's a very small, about the size of a shot glass is how we usually describe it. And then we take a piece of intestine and hook that up to the gastric pouch. By bypassing the intestines, people are not able to absorb as many calories, which also affects the ability to absorb certain vitamins. And a bypass patient will need vitamin supplementation typically the rest of their life. And with all bariatric patients, we need to follow their labs periodically to make sure that they're not becoming malnourished.
Okay, now, as you're explaining this to me, and I'm thinking of staples, and I'm thinking of, you know, all these different things, these foreign objects, etc. You've done this, okay? So you'd be able to explain to me when you're telling me, because I'm the kind of person that likes to see everything.
Actually, we have teaching charts in the office, and if necessary, I draw out or add to the drawings. So, yeah.
First and foremost, I want everyone to, at least I feel this way from interviewing the many doctors I have. No doctor or anyone, no doctor that I know would ever do a surgery unless it's absolutely necessary and they know all of the precautions before they go into that surgery. It's just not a matter of, let me just get this person, and it doesn't work that way. And sometimes people say, hey, they just do it for the money. That's no way, that's not even in, you know, I mean, you have that some kind of mentality. I want to erase that kind of mentality. If you're in, it's like, you know, the technologies we have today, as you see in different fields, it's just amazing. And you know, so with Lehigh Valley, you know, having all of these references you have, so we can eliminate those fears, correct?
Yes. The key thing with obesity is that it's related. There are many health problems that arise from it, including people having an increased risk for cancer, type 2 diabetes, heart disease, peripheral vascular disease. We operate on patients who are obese to try to fix these problems, and it's really to resolve the medical issues related to obesity, not financial. We're not trying to make people beach bodies or
Yes.
things along that line. We're trying to address their health issues. With weight loss, many patients experience more energy and a better self-image,
Yes.
which is very important. And they're able to connect with other people who are in the beginning stages of weight loss and considering surgery. And that's important and it's helpful.
You know, you're so true. You start feeling better about yourself because how you got in that situation, okay, forget about it. You've addressed it. So you go through all of the, when I say psychological, I mean, I guess you have to understand the person and the direction they're going to take, right? And
we have nutritional counselors, the patient's regular doctor, and also psychological counselors available. We also have a support group. It is important because, as you pointed out, not everybody eats for the same reason. Some people will eat when they're stressed. Yeah. Some people will eat when they're happy. Some people are just not motivated to get off the couch. It's more fun to watch TV than go for a walk.
Well, it's fun to watch the Sam Lesante show. Other than other programs, a different thing. Age factor. Okay, so, all right, I'm 40, I'm 50, I'm 30, I'm 70. Okay, what are the age factors?
In general, we consider I consider anyone from age 18 to 65. But as people are living to older ages, and I believe the age is expected 78 in this country. If somebody who is in their late 60s came to me with serious health problems, and they have the potential to live another 10 or 20 years, I would certainly discuss bariatric surgery with them.
So it's a matter of how you want to live your lifestyle, etc. It's a safe surgery, correct? I mean, it's
all surgery has risk,
Yeah.
just like getting in your car and driving to work has risk. But bariatric surgery is the safest it's ever been at this point. That's why it's being offered to help resolve issues related to obesity.
Now, folks, I'm going to give you some information here. We played a show a number of times, so sometimes there's a lot of events that happen. Dr. Walko and the bariatric department, they have events where you can go in and get information, maybe talk to some people who've had the surgery, etc. I highly recommend that you go to their website, LVHN.org, and look for those events. And of course, for those of you who are watching us here in the Hazleton area, on our news, SSP TV News, we do have updates as to when these events are happening. This show also plays, as you know, in the Wilkes-Barre, Kingston, Mountaintop area, but you can do that. But also, if you're having some concerns right now, it's 570-501-LVHN. Call and ask for the bariatric department and get information. Am I correct in saying that? Okay.
Yes.
Because sometimes, you get a little concerned about what's happening. I could say to you, Dr. Walko, welcome aboard. It's nice to have you, and had a little fun with you. It's interesting, but I wish you the best. And I could say this: I don't think you'd be in LVHN unless you were ultra qualified. So I wish you the best.
Thank you very much, Sam.
Okay. Once again, folks, it's Dr. Martin Walko. He is a general surgeon and bariatric surgeon. If you're suffering with overweight and you know you're obese, just give them a call and find out about it and get your life back on track. We'll see you next time.